Did you know that the stiffness you feel when you wake up isn't just an inevitable consequence of aging, but a real warning sign? For decades, many people over the age of 50 have been told that waking up with stiff joints, difficulty bending, or that heavy feeling in the legs is completely normal. But science shows a very different reality. Studies from the National Institute on Aging have revealed that morning stiffness, loss of flexibility, and even chronic pain are directly linked to the lack of daily stimulation in the body's tissues. In other words, it's not age that's stealing your mobility, it's the lack of proper movement. As we age, muscles tend to shorten, joints lose lubrication, and the fascia, that connective tissue that surrounds all your muscles, begins to lose its elasticity. This process creates tension, limits mobility, and can lead to the loss of independence in simple activities like climbing stairs, standing up from a chair, or even walking long distances. But here's the part most people don't know. It's possible to reverse much of this with just 10 minutes a day. We're not talking about expensive medications, frequent massages, or high-end equipment. The secret lies in specific isometric stretches that can restore circulation, bring elasticity back to the muscles, and reprogram your body to function better. Today, you'll learn the 5 essential stretches every adult should do daily. These have been tested and proven in clinical studies, show rapid benefits, and, most importantly, can be adapted to any physical condition without straining your body or leaving your home. Stretch 10. Cat-cow. Imagine your spine as a row of dominoes lined up. Over time, those dominoes stop moving in harmony, start pressing against each other, and gradually, pain begins to settle in. That's exactly where the cat-cow movement comes in as a powerful tool. This exercise combines 2 alternating positions. The first one rounds the spine, like an arched cat, and the second gently extends it, like a cow's posture. By switching between these 2 positions, you mobilize each vertebra from your neck to your tailbone, promoting disc hydration and stimulating the production of synovial fluid, the natural oil of the joints. But there's more. Studies in applied neuroscience show that this movement also activates the vagus nerve, one of the main regulators of the autonomic nervous system, responsible for lowering stress hormones like cortisol. This means that with every inhale and spine extension, and every exhale and rounding, you're not just lubricating your spine. You're also sending a signal of relaxation to your brain, much like the effects of meditation. This is the kind of exercise that brings more than just physical benefits. It reprograms the way your body deals with stress and anxiety. Clinically speaking, the cat-cow strengthens the paraspinal muscles and the deep stabilizers of the core, such as the multifidus and the transverse abdominis. These structures are essential for posture and stability, helping prevent overload in the lower back and neck areas. For people with mild disc herniation or even scoliosis, practicing this movement slowly and within the body's limits can reduce painful pressure points and restore muscular balance. Think about it. If just one movement can reduce your pain, improve your mood, and even help you sleep better, imagine the impact of combining 5 exercises that work throughout the body. And the next stretch doesn't focus only on the spine. It targets the muscles that literally pump life through your body. Stretch 9. Calf stretch. Your calves are much more than the muscles that support your feet. They act like natural pumps that push blood back to your heart with every step. But over the years, inactivity and lack of stretching cause these muscles to shorten and lose elasticity. The result? Slower circulation, heavy legs, swelling, and frequent nighttime cramps. The calf stretch is simple but essential. Just a few seconds of practice can already bring benefits, and holding the position for 30 to 60 seconds is enough to release built-up tension, restore ankle mobility, and even relieve pressure on the Achilles tendon. Studies show that people with flexible calves have a lower risk of falling, improved walking stability, and feel lighter legs almost immediately. Science also shows that stretching this area activates neuromuscular receptors responsible for regulating involuntary contractions, reducing the frequency of cramps. It also improves vascular health, helping to prevent conditions like varicose veins and edema. This means that this simple habit can transform your walking experience, bringing back the lightness you thought was lost with age. You can perform it standing, with your hands resting on a wall and one leg extended back with the heel firmly on the floor, or sitting, using a towel to gently pull the toes toward your body. The most important thing is to hold the position without pushing beyond your limits, always breathing deeply. Now, if the spine and calves already play a central role in your mobility, there's one area that truly serves as the axis of human movement: the hips. And this is exactly where the next stretch comes in. After working on your spine and improving circulation with the previous stretches, we arrive at one of the body's most critical regions: the hips. Few people realize it, but hip stiffness is one of the main causes of lower back pain, difficulty climbing stairs, walking, or even maintaining balance. That's why the next exercise is essential. Stretch 8. Butterfly stretch. Imagine your hips as the hinges of a door. If those hinges are rusty, the door doesn't open properly. The same thing happens in your body. When your hips are stiff, your entire movement system suffers. Your lower back takes the strain, your knees are affected, and even your walking pattern changes. The butterfly stretch is simple, yet powerful. Sitting on the floor, you bring the soles of your feet together and let your knees gently fall to the sides. This position directly activates the hip joint and stretches the inner thigh muscles: adductor longus, adductor magnus, pectineus, and gracilis, which often shorten due to too much time spent sitting. Research published in the Journal of Geriatric Physical Therapy shows that maintaining hip flexibility can reduce the risk of falls in older adults by up to 30%, as well as improve trunk stability and decrease the incidence of chronic lower back pain. Another often overlooked benefit is improved venous circulation in the lower limbs, which helps relieve heavy legs, varicose veins, and swelling. From a postural standpoint, this exercise also helps release the pelvis and redistribute load across the lumbar spine, reducing the constant pressure that causes pain when standing for long periods. And the best part, it's easy to adapt. If you feel a lot of stiffness, simply place pillows under your knees or lean your back against the wall, making the movement accessible even for those with joint limitations. By practicing this stretch daily for just 2 minutes, you not only restore mobility to your hips, but also regain a sense of lightness, stability, and control over your own body. Many physical therapists consider this movement one of the pillars of mobility for older adults. Now that your hips are more relaxed, it's time to work not only on the body, but also the mind. And for that, there's a stretch that works like a true reset button for your entire system. Stretch 7. Child's pose. Child's pose, also known in yoga as balasana, goes far beyond a simple stretch. It is a deep recovery position that works both the body and the mind. To perform it, kneel down, sit back on your heels, and lean your torso forward, bringing your forehead toward the floor or a pillow. Your arms can be extended in front of you or relaxed alongside your body. From a biomechanical perspective, this posture passively stretches the paraspinal muscles, which support the spine, the glutes, and the hip joint capsule, reducing compression in the lower back and restoring elasticity to the deep tissues of the spine. It also relieves shoulder tension and improves hip mobility safely without effort. But the benefits don't stop there. As the torso drops forward, intra-abdominal pressure is reduced and the diaphragm naturally expands, which improves breathing quality and provides immediate relief. This expansion also stimulates the vagus nerve, which activates the parasympathetic nervous system, responsible for regulating vital functions like heart rate and blood pressure. Studies published in sports physiotherapy journals show that restorative postures like balasana not only reduce the activity of the sympathetic system linked to stress and alertness, but also increase levels of serotonin and oxytocin, neurotransmitters associated with calm and a sense of well-being. This means that by practicing this exercise for just 1 minute with deep breaths, you're not only stretching your body but also training your mind to relax, reducing anxiety, improving sleep, and even relieving chronic pain linked to emotional tension. Another advantage is adaptability. Those who feel discomfort in the knees can place a blanket under the legs. Those who struggle to lower the torso can use a support pillow. The key is to respect your body, letting the posture become a space for recovery rather than strain. This is the perfect exercise to end the day or to reset the body after a stressful morning. But before wrapping up the routine, we still need a movement that combines 3 essential benefits: spinal relief, digestive stimulation, and improved body balance. Stretch 6. Supine Twist. The supine twist may seem simple. Lying on your back, you bring one knee toward your chest and then gently let it fall to the side, while keeping both shoulders grounded on the floor. However, the effects of this posture run much deeper than they appear. This controlled twist creates a gentle decompression in the lumbar spine, relieving pressure between the intervertebral discs, especially in the L1 to L5 region, one of the most affected by inactivity and loss of abdominal strength as we age. Studies published in the Spine Journal and the Journal of Manipulative and Physiological Therapeutics confirm that passive rotations like this help hydrate the discs, restore spinal mobility, and reduce myofascial tension. Additionally, this posture has a powerful effect on the digestive system. The gentle twist stimulates the solar and abdominal plexuses, improving intestinal function and relieving common issues such as bloating or constipation, especially in older or sedentary individuals. Another lesser-known benefit is the activation of the body's core stabilizer muscles, including the internal and external obliques and the transverse abdominis. By strengthening these muscles, you improve coordination between the torso and pelvis, gain better balance, and reduce the risk of falls. From a neurological standpoint, much like child's pose, the supine twist stimulates the vagus nerve and activates the parasympathetic system. This lowers cortisol levels, improves sleep, and creates a deep sense of calm and relaxation. And the best part? It's an easy exercise to adapt. If there is discomfort in the hip or knee, simply support the leg with a pillow. Stretch 5. Neck and trapezius. How many times have you woken up with neck pain or stiffness? This area is one of the most affected by stress and poor posture, especially after the age of 50. The problem is that muscles like the upper trapezius and the sternocleidomastoid are constantly tense, whether from sitting for hours, looking at screens, or even poor sleep. The neck stretch is simple. Sit or stand with your spine straight. Gently tilt your head to one side, bringing your ear closer to your shoulder, while the hand on the same side can lightly pull the head to deepen the stretch. The other hand can rest on your lap or be extended by your side to enhance the movement. Hold for 20 to 30 seconds on each side. Physiologically, this stretch helps reduce built-up tension in the neck muscles, improves blood circulation in the area, and even relieves tension headaches. Studies published in the Journal of Physical Therapy Science show that regular neck stretches increase mobility and reduce chronic pain in the neck and shoulders. Additionally, relaxing the upper trapezius significantly improves posture, since this region often pulls the shoulders upward, causing overload in the cervical spine. Incorporating this movement into your daily routine brings more lightness and stability to your upper body. Stretch 4. Shoulders and chest. A hunched posture is one of the most visible signs of aging. It doesn't happen overnight. It's the result of years of shortening in the chest muscles, pectoralis major and minor, combined with weakening in the back muscles. This combination creates the classic slouched shoulders, which not only affect appearance but also hinder breathing and increase the risk of neck and lower back pain. The chest opening stretch is one of the most effective ways to combat this. Stand against a wall or door frame. Position your arm bent at 90 degrees with your elbow at shoulder height. Gently lean your body forward until you feel the chest open and stretch. Hold for 20 to 40 seconds on each side, always breathing deeply. This movement promotes expansion of the rib cage, improves shoulder mobility, and releases the chest muscles, allowing for deeper and broader breathing. According to studies from the American Journal of Sports Medicine, stretches that open the thoracic region increase respiratory capacity in older adults and reduce pain associated with a hunched posture. The immediate effect is a feeling of lightness and improved posture, as if the body naturally straightens itself. Over time, this stretch helps reduce the risk of shoulder injuries and strengthens the stability of the thoracic spine. When you look at this stretch routine, you might think they're just simple movements. But the truth is, each one carries enormous weight in terms of health, well-being, and even longevity. The human body responds impressively to consistent stimulation. And even if you're over 50, 60, or even 70 years old, science shows it's never too late to regain mobility, energy, and independence. Researchers from the National Institute on Aging have observed something very interesting. The stiffness we feel in the morning isn't caused by age itself, but by a lack of daily movement. When we don't stimulate muscles, joints, and connective tissues, they lose elasticity, circulation decreases, and the body starts to send warning signs. That's why we wake up with pain, stiff necks, difficulty bending over, or even that heavy leg feeling. The good news is that this can be reversed with just a few minutes of daily practice. Stretch 3. Hamstrings. Have you ever noticed how, when you try to bend down to tie your shoes or pick something up, the back of your legs feels like it locks up, as if a rope were pulled tight? That sensation comes from your hamstrings, a group of 3 main muscles: the semitendinosus, semimembranosus, and biceps femoris, located at the back of your thighs. They play a key role in walking, balance, and posture. But unfortunately, they're also one of the muscle groups most affected by shortening as we age. The shortening of the hamstrings is not just a matter of aesthetics or flexibility, it has a direct impact on the lower back. When these muscles become tight, they pull the pelvis backward, altering the natural curve of the lumbar spine and increasing pressure on the intervertebral discs. This postural imbalance is one of the most common causes of chronic lower back pain in adults over 40. That's why hamstring stretching must be part of any mobility routine, especially for those who want to protect their spine and preserve their range of motion. Performing this stretch is simple, yet highly effective. You can start seated on the floor, with one leg extended in front of you and the other bent in a comfortable position. From there, gently lean your torso toward the extended leg, reaching for the foot with your hands. The goal isn't to force yourself to touch your toes, but to keep your spine long and feel the stretch at the back of your thigh. Over time, the movement will become easier, and you'll notice the area becoming more flexible. Scientifically, the benefits are broad. Research published in the Journal of Orthopedic and Sports Physical Therapy confirms that regular hamstring stretching improves hip mobility, significantly reduces symptoms of chronic lower back pain, and even lowers the risk of injuries during light physical activities like walking or strength training. Another interesting finding comes from studies with older adults who participated in flexibility programs. In just 6 weeks, they saw up to a 20% improvement in their ability to lean forward without pain, something that seems simple but represents a huge gain in daily independence. But the benefits don't stop at the spine. Stretching the hamstrings also improves blood circulation in the back of the legs, reducing the feeling of heaviness and swelling that often occurs after long periods of sitting. This stretch helps keep the muscles oxygenated and ready to respond to quick stimuli, like standing up from a chair or taking a firmer step during a walk. And here's a motivating fact. Hamstring flexibility is one of the most commonly used indicators in fitness assessments to evaluate healthy aging. People who maintain good range of motion in this area have greater functional independence, lower risk of falls, and even better quality of life. In other words, every time you bend to stretch your legs, you're not just gaining flexibility, you're directly investing in your autonomy and longevity. Think of it as an investment of just 10 to 15 minutes a day. While many people spend hours with medications, appointments, or expensive treatments, you have in your hands a simple, free, and incredibly effective tool. And week by week, your body will thank you, with less pain, more energy, and a growing sense of freedom. So don't put it off. Add hamstring stretching to your routine today. Start slowly, respect your limits, but move forward knowing that every small improvement is a big step toward a more active and healthier life. Because aging doesn't mean losing movement. It means finding new ways to keep moving. Stretch 2. Quadratus Lumborum. Few people are familiar with the Quadratus Lumborum, but almost everyone has felt the effects when it's tight. This deep muscle, which connects the pelvis to the lower ribs, is one of the key stabilizers of the lower back. When it becomes shortened or overworked, it can cause that uncomfortable pain we feel when getting out of bed, standing for long periods, or even after lifting something heavy. The good news is that there's a simple yet incredibly powerful stretch that can restore freedom to this area: the side stretch. The Quadratus Lumborum is engaged in nearly every movement we make without even noticing, when walking, bending to pick something up, or simply standing. It acts as a silent stabilizer, keeping the pelvis aligned and supporting the spine. However, over time, especially in people who spend long hours sitting, this muscle tends to shorten and accumulate tension. The result is frequent lower back pain, stiffness, and even limitations in basic movements like rotating the torso. The side stretch is a practical way to counter these issues. Stand with your feet shoulder-width apart and knees slightly bent. Raise one arm overhead and gently lean your torso to the opposite side, as if trying to reach the ceiling with your hand. The key is not to lean forward or backward, but to keep your body aligned, feeling the stretch extend through the side of the torso and into the lower back. Hold for 20 to 40 seconds, then repeat on the other side. If you prefer, you can also do this movement seated, especially on a firm chair. Simply keep your feet flat on the floor, raise one arm, and lean your body sideways. This modification is great for those who feel unsteady standing or have knee limitations. What does science say about this movement? Studies published in the Journal of Back and Musculoskeletal Rehabilitation show that stretches targeting the Quadratus Lumborum significantly reduce chronic lower back pain. This is because the movement releases accumulated tension, improves blood circulation, and increases the elasticity of the connective tissues that support the spine. Additionally, this stretch improves lateral spinal mobility, a range often neglected in traditional workouts but essential for injury prevention. Another important point is that stretching the Quadratus Lumborum also indirectly activates other muscles in the area, such as the obliques and intercostals. These muscles assist in breathing by helping to expand the rib cage. In other words, this stretch not only relieves lower back pain, but also promotes deeper breathing, improving oxygenation, and bringing an immediate sense of relaxation. Now imagine the impact of adding the side stretch to your routine, along with the others we've already introduced. Day by day, you're not just releasing muscles, you're also unlocking patterns of stiffness built up over the years. It's like your body is freeing itself, step by step, from invisible chains that restrict your vitality. The Quadratus Lumborum may be a quiet muscle, but when it's healthy, it supports everything you do. So don't ignore it. Dedicate 1 minute a day to this stretch and feel the difference. Because in the end, it's not grand gestures that transform our health. It's the small habits we repeat every day. And among those habits, stretching might be one of the most powerful tools you can adopt to ensure active, pain-free, movement-filled aging. Stretch 1. Wrists and forearms. If there's one part of the body we rarely think to stretch but use constantly, it's the wrists and forearms. Think about it. From the moment we wake up and grab a glass of water, to opening doors, carrying bags, or typing on a phone, the muscles and joints in this area are constantly at work. And over the years, a lack of attention can lead to stiffness, pain, and even conditions like tendinitis or carpal tunnel syndrome. That's why incorporating specific stretches for the wrists and forearms is so important, especially after age 50. The flexor and extensor muscles of the forearm act like cables that control hand movement. They pass through tendons that run across the wrist, allowing you to open and close your hand, grip objects, and perform precise movements. But when these cables are overused and lack proper mobility, they begin to lose elasticity. The result is pain, tingling, difficulty gripping objects, and in some cases, even a loss of strength. Wrist stretching is simple and can be done anywhere. One of the most effective ways is to extend one arm forward with the palm facing up. With the other hand, gently pull the fingers downward, stretching the inside of the forearm. Hold for 20 to 30 seconds, feeling the stretch in the flexor muscles. Then, turn the palm down and pull the fingers downward again, this time stretching the extensors. Repeat on the other arm. At first glance, it might seem like too small of a movement to matter, but the cumulative effects are significant. Studies from the Journal of Hand Therapy show that regular wrist stretches reduce joint stiffness, increase range of motion, and improve grip strength, the ability to hold objects firmly. For older adults, this means more independence in daily tasks like opening jars, holding utensils, or carrying groceries. In addition, there's a direct impact on injury prevention. Aging naturally reduces joint lubrication and tendon elasticity. By keeping your wrists and forearms stretched, you lower the risk of inflammation like tendinitis, as well as pain from repetitive use, something common in people who spend a lot of time typing or using smartphones. Another benefit of this stretch is improved circulation. Flexion and extension movements increase blood flow in the area, helping to reduce tingling and numbness in the hands. This is especially helpful for people suffering from carpal tunnel syndrome or peripheral neuropathy, conditions that can be eased through simple mobility exercises. Now imagine combining this stretch with all the others we've explored. A loose spine, mobile hips, flexible calves, open shoulders, a relaxed neck, and now, strong and steady hands. It's like giving your entire body a renewed sense of youth and vitality. You'll regain control over your movements and feel confident carrying out everything from simple tasks to the most joyful moments in life. The message is clear. Don't neglect the small muscles and joints. Often, they're the very things that determine your independence. Every time you stretch your wrists, you're ensuring that you'll keep opening doors, holding objects, and interacting with the world in an active way. It's a small gesture with massive consequences. So, set aside a few minutes each day to care for this area. It can be in the morning, before you start your day, or at night as part of your wind-down routine. The key is consistency. Within a few weeks, you'll notice your hands are stronger, your movements more fluid, and your confidence renewed. This isn't about perfection or extreme effort. It's about consistency. Just 10 to 15 minutes a day can be enough to wake up your body, release tension, improve circulation, protect your joints, and restore confidence in your movement. Imagine living without that heavy leg feeling, without constant lower back pain, without the fear of tripping. Imagine being able to get up from a chair with ease, sleep better, and wake up refreshed. So here's my challenge to you. Choose one of these stretches and start today. Leave a comment saying which one you'll begin with. Share your experience, because what you do can inspire others to start moving too. And if this content brought value to your life, leave a like, subscribe to the channel, hit the notification bell, and share this video with someone you care about. Movement is the key to independence. Don't wait any longer. Start now.